I'm Mark Pegram. I'm the Associate Director for Clinical Research at the Stanford Comprehensive Cancer Institute and a member of the Division of Medical Oncology. NTRKs are genes encoding members of the neurotrophic tyrosine kinase receptor, NTRK. It's a family of proteins. This kinase enzyme is a membrane-bound receptor that upon activation by growth factor ligands that activate these receptors, called neurotrophin ligands, can result in activation of NTRK receptors which phosphorylate members of the MAP kinase signaling pathway, which is a potent oncogenic signaling pathway in multiple tumor types. Researchers identified NTRK gene rearrangements in more than 24 different types of common and rare solid tumors. These gene rearrangements result in TRK fusion proteins that are a result of this gene rearrangement. And these fused proteins become aberrantly activated even without the ligand activation. And they become oncogenic drivers in a wide variety of tumor types, both in adults and in pediatric patients. In the case of breast cancer, there is a very rare subtype of breast cancer called secretory breast cancer that harbors one of these NTRK fusion gene rearrangements. Secretory breast carcinoma is generally a slow-growing breast cancer that's actually more common in younger patients, and was originally termed, in fact, juvenile breast cancer for this reason. It's called secretory breast carcinoma because of its abundant secretion of mucins within the tumor. Secretory breast cancer is rare. It accounts for only about 0.1% of all invasive breast cancers. Typically, secretory breast carcinomas are negative for hormone receptors and don't express HER2. Axillary lymph node metastasis and distant metastasis, indeed, are actually uncommon. So this is a more indolent behaving type of subtype of breast cancer. Interestingly, most patients with pure secretory breast cancer harbor an ETV6 NTRK3 gene rearrangement. So that's the molecular signature and the hallmark in terms of molecular pathologic classification. It is the hallmark of this rare type of cancer. Now, larotrectinib and entrectinib are new drugs that inhibit TRK fusion proteins. They are approved for any tumor type that have these NTRK fusion mutations. So the approval is actually tumor type or tissue agnostic. The most common adverse reactions with these drugs are fatigue, GI upset, increased liver enzymes. Clinicians are to monitor the liver enzymes periodically while on these medications and adjust the dose accordingly if transaminase elevation is encountered. There can also be potential for some neurotoxicity, namely a feeling of dizziness, particularly in the elderly. So clinicians and patients should be mindful of this side effect also and adjust the dose accordingly.